respirators, and I'm going to start with our medical grade masks to start. These are important as opposed to cloth masks. The important difference is that these are made out of polypropylene and they have multiple plies in them. And that literature is showing that these filter viral sized particles much better than a cloth mask does. So the key thing with these is you're putting them on, you're pulling it down over your chin, you're pinching over your nose, and then away you go. One of the things I've seen a lot of, not so much in healthcare workers, but I've seen a lot in the public is, I just need to talk to you, so I'm going to take my mask off. You don't need an infectious disease specialist to tell you that that makes no sense. You got to leave it on at all times. One nice thing about these is they're actually quite comfortable, and most people can live with these on their face for quite a long time. Another thing to mention, I'm sure 99% of you know this, is the color has to be on the outside. You don't want the color on the inside because the filtration characteristics are actually different depending which way you wear the mask. Last thing I'll say about this is that not only does this work to prevent a fair number of particles getting in, but it also works well to prevent particles getting out. In fact, if we are putting a mask on a source patient, these are better than an N95 respirator. And the reason being is this is catching the droplets as they come out. Whereas a respirator, if you cough, it can actually get around the sides even easier. So we don't use respirators for source patients. We use medical masks for them. And that's it for masks. One of the things that's recommended in our guidance is if you don't have access to a respirator, an acceptable masking gear for patients with suspected or confirmed COVID is actually double medical masking. So I can put this one on top of the first one, pinch the nose, make sure it's sealed all around. This is actually still pretty comfortable. And there are good laboratory studies showing that this filters a lot better than one. And the filtration starts to approach what you might get with a respirator. The only other thing I'll mention about these masks is if for some reason it's baggy down here, mine is not, but you are able to take your earpieces and actually tie a little knot here to make it tighter around the bottom. I'm going to talk about N95 respirators. First of all, many of you might have noticed that I don't have a beard anymore. And the reason I don't have a beard is so that I can show you properly how to use these. These are devices that I've used for my whole career because my clinical expertise is in multi-drug resistant tuberculosis. So I used to wear these every week when I was back doing clinical work. So the key thing with respirators is when you put them on, they go on like this. And you need to notice that the straps are not crossing each other. One of the first things you'll see a lot of people doing is the straps are crossed with one crossing the other. So you'll see this down here and this up here. That's not the way you wear these. The filtration is not guaranteed if you wear them that way. So I'm going to bring it down like this. The next thing you do with these is you have to pinch them on your nose. And then you do what we call as a fit check, where basically once you've got it secured on your face, you're going to breathe in. And I don't know if you can see that, but the mask pulls it against your face a little bit. I'm not actually fit tested to this particular respirator, so I might actually fail the fit check, although it's probably okay for me. Other thing you'll notice with these is they are freaking uncomfortable. This is already bothering my nose. A lot of people feel a bit short of breath when they're wearing them because it's much harder to breathe in this than wearing even two medical masks. There's been a number of studies looking at people wearing respirators versus medical masks for respiratory virus infections. And interestingly enough, although you see a difference in the lab in terms of what particle sizes are being filtered by these, in the real world, a very large study out of Hamilton done a few years ago shows no difference in protection between this and a medical mask. And one of the reasons for that might be that This is really uncomfortable. So what you see people doing is this. This is not filtering anything, right? You need to have your PPE only works if you're actually wearing it the whole time. And so you'll see people taking it down because it is uncomfortable. It starts to hurt your nose. It starts to hurt your ears. It's hard to hear people, etc. So my biggest concern with N95 respirators is the fact that in the real world, it's very hard for people to comply with them. So if I was doing most of my clinical work right now, I would far rather prefer to wear two of these. Because two medical masks will give me very good filtration of even the small airborne particles, not quite to the extent of a respirator, but very close. It will provide excellent protection against the larger droplets, which is where the majority of the virus is. And I can leave this on all day. Like, this is not bothering me, and you can still hear me pretty well. Whereas when I wear this, not so good. So my personal advice is I would wear this for aerosol generating procedures. I would wear this for suspected or confirmed COVID patients. I would not be wearing this for everyday use because I believe the literature will tell us, and I think your experience will tell us, it's very hard to comply with these.